Oxygen therapy is a vital part to taking care of our neonatal patients. Like our adult counterparts, we must be able to identify, using our clinical judgment and skills, to determine when it's most appropriate to intervene with oxygen therapy. Indications which would warrant the use of oxygen therapy in our neonatal patients would include a documented history of hypoxemia, or if there's an acute sudden onset of hypoxemia due to some pre-existing condition or in an emergent situation. At any rate, we must use our decision-making ability to select the appropriate therapy for our patients. From an equipment standpoint, it's important that we obtain the appropriate equipment. And I pay attention to the flow meter. What you're viewing right now is an adult flow meter, but I have zoomed into the actual numbers so that I may be able to give better identification to the landmarks on a neonatal flow meter. Most flow meters for our neonatal patients only require that we go up to a maximum of 2 liters per minute. So where that you see on this adult flow meter 0.5 liters, for the neonatal flow meter that will actually be 1/4 of a liter. Where you see hole number 1 would be considered 1/2 liter. Right above that, where you see the line, would be 3/4 of a liter. And then where you see number 2, that would be considered 1 complete liter. So from a flow meter standpoint, there are some differences in the neonatal world as opposed to the adult world. Most neonatal intensive care units are properly equipped with the 1/4 liter flow meters. And so you don't have to go out and just find the special flow meter, because they will already be at the patient's bedside or plugged into the wall. Now, as I zoom out, I'll point at some of the ways that we could perform this oxygen therapy for our patients. Beginning to our right, we have our traditional water bottle along with our nasal cannula. Now, as I zoom in, notice how small the nasal cannula is, in particular when we look at the prongs that fit inside the nose. They're very tiny, very small, because we are dealing with neonatal patients. And in most cases, the nasal cannula is the preferred method for oxygenating our patients. As I mentioned before in reference to the flow meter, we normally use the nasal cannula on 2 liters per minute or less. For our pediatric patients, it's okay for us to increase that liter flow to as high as 6 liters per minute. When using the nasal cannula, there are certain pieces of equipment that you would need. Besides the flow meter with the appropriate flow liter range, we would also need our water bottle for humidification. And make sure that you do have the appropriate size cannula. Additionally, we would also be required to use a blender. For demonstration purposes, I will reserve the blender demonstration for lab so that we can actually get hands-on interaction with that. But the purpose of a blender is to make sure that we give our patients the exact amount of FiO2. In particular, when we talk about premature neonates, too much oxygen is a bad thing and can lead to retinopathy of prematurity, otherwise known as ROP, or bronchopulmonary dysplasia, which is BPD. Those are some situations in which too much oxygen is a bad thing, and we will go over that information in greater detail at a later date. But as I mentioned, let me zoom out. As I mentioned, the nasal cannula is the preferred way to administer oxygen therapy to your patient. We also have a non-rebreathing mask, in which we know from our adult studies that we can provide 100% oxygen with the use of this mask as well as the reservoir. Now, the interesting thing is that this is a very helpful mask, but neonates do not like things on their face. So therefore, to get a tight seal, in particular if the patient actually needs 100% oxygen, is almost impossible with a neonatal patient. But just know that they do make these particular masks. Also, as I scroll to the left, we have what we call an oxy mask or a oxy mist mask, or sometimes people refer to it as a mist mask tint, so to speak. Now, with this mask, we have the luxury of being able to provide 100% oxygen, but we also have the comfort of a simple mask. So it should be more comfortable for your patients to tolerate. A lot of neonatal and pediatric masks have clever designs, cartoon-like characters on them, because the babies and the little kids like to be entertained, and if they're entertained, then they're more likely to comply with whatever it is that we're trying to do. I point out that with the oxy mask, that the FiO2 and the flow rate that should be used to run the mask is dependent upon the patient's respiratory rate and their tidal volume and how close of a seal we have. So just know that with this oxy mask that we do have some variability there. Now, just because we have all of these different variables, if I can zoom in to the tag here that is on the very tip where we will plug it into the flow meter, it shows us what our flow rate should be set on. So as you can see, a flow rate of 1 to 3 liters per minute gives us an FiO2 that ranges between 24 to 42%. 3 to 5 liters, 42 to 58%. I believe 5 to 8 liters would be 58 to 74%. Then anything greater than that, we see that we can get as high as roughly about 90 to 99% on our FiO2. So because of that variability, in an emergent situation, the oxy mask may not be the best choice for your patient. But these are just some of the examples of oxygen therapy devices that we will use with our patients. Primarily, we will focus on the nasal cannula. And as you review your data ARC notes, just note the indications. Definitely note the hazards and complications. And from a situational standpoint, just know that some masks work better than others. At any rate, when we apply the use of oxygen therapy to our patients, we must always remember to evaluate the patient. So look at the vital signs, blood pressure, heart rate. Also notice the heart rhythm, the respiratory rate, and notice whatever their current saturation is. Also assess the patient for their color and look for those signs of labored breathing. For our neonatal patients, that's going to be retractions, nasal flaring. Also, they may be diaphoretic or sweating. Perform auscultation on your patient. Listen to their breath sounds. It could be some type of disease process that is causing this increased work of breathing. If anything is abnormal or adventitious, then definitely we want to make note of that. But this concludes the demonstration or the video on oxygen therapy.